Coming up, we'll be on location at OptimEYES in Ashburn, Virginia, discussing the latest advances in vision care and how they can help you improve your vision with one of this region's top optometrists, Dr. Seema Mohanan. Dr. Mohanan received her optometry degree from Pennsylvania College of Optometry and is widely recognized as one of this region's leading optometrists. Welcome, Dr. Mohanan. It's a pleasure having you on our program.
Thank you.
It's your first time, in fact, on the Top Doctors interviews. We have a lot to talk about. We have a patient that we're going to be speaking with a bit later as well, but I wanted to begin, if I may, Doctor. What are some of the more common problems that you're addressing here, that you're seeing in the patients that come to you?
I'm sure most of us can relate to spending a lot of time in front of digital devices, like cell phones, computers, tablets. Just as technology has improved, so has the development in lenses and coatings for glasses, especially those that filter out blue light.
Can you please tell us about that?
Sure. As far as blue light, a lot of these newer devices like our cell phones, our computer screens, they actually are made from LED screens. And LED screens actually emit quite a bit of blue light. And unfortunately, with long-term exposure to blue light, you can actually have damage to the eye.
My goodness, I don't think a lot of folks are aware of that potential problem. And since we're all looking at one screen or another, right? Whether it's a computer screen or a handheld device, cell phone, whatever, didn't realize that they can be causing problems through the blue light that can take its toll over time, I take it, Doctor?
Exactly.
And then, so what's the next step to correct that problem?
So most of us are actually spending a lot of time not only in front of one screen, but multiple screens. So now with technology as far as lenses that actually are freeform design, multifocal lenses, and blue light anti-reflective coatings, they can actually help minimize a lot of that eye strain.
That's certainly great to know. So in other words, as more and more people are looking at various screens that technology has enabled us to be able to do, and the problems that are resulting, as you said, through the blue light, we now have advances on the technology on the vision care side to help offset those problems that are caused by glare.
The combination of those newer freeform lenses and the coatings can actually help minimize all of that.
Now, would kids also be a segment of the population that could benefit from these glasses you're talking about?
Definitely. You know, kids these days now are either on, they actually have special tablets made for kids that have the same LED screens. I know my 3-year-old knows how to look at the iPhones and everything. And so I mean, that blue light coating can actually be put on any pair of glasses.
Can you please tell us a little bit more about the various eye care and eyewear products that you have here?
Yes, so we are actually a full scope optometry practice, so we offer comprehensive eye exams. We'd actually start with our pre-screening process that would actually help kind of see what your prescription is. We'll check the pressure in your eyes, and then we'll also actually take a picture of the inside of the eye that gives us a good view of the macula, make sure that everything inside the eye is healthy, and then we can move on to our exam, where we can then kind of fine-tune your prescription and figure out what's the best lenses for you.
So basically, it's not a cookie-cutter approach, which is great to hear. It's pretty much a customized eyewear, eye care solution based on each particular patient's individual situation.
Right, listening to what the patient's needs are and definitely figuring out what would work best for them is what we do.
That's great. And how long do these exams generally take? And I put in the disclaimer that I'm sure it varies depending on each patient and his or her problem, but generally, what are we looking at?
From start to finish, as far as exams, usually about 20 minutes is enough time for us to figure out what's going on. Of course, if we need additional follow-up care, we can do that as well. But I would say around 20 minutes.
So for the busy professionals that are watching right now, or students, or whoever's out there that's got a lot going on in their lives, in other words, they can even come during their lunch hour, for example, to have this exam.
And we offer that as well, and we have evening appointments as well for those that want to come in after work. We actually offer those as well, and weekends too.
That's great, to make it very convenient for them. I wanted to ask you, Dr. Mohanan, what kind of results are your patients experiencing and that we can expect to achieve from the different eye care products that you have here?
I think the major result that patients will find is that their eyes are a lot less tired by the end of the day. Those that spend so much time in front of the computer or even on their phone, the eyes get tired very quickly. And so if you're wearing the right prescription, wearing the right type of lenses, wearing the right type of coatings, it'll actually relieve a lot of that eye strain.
We're now going to meet a patient of Dr. Mohanan and OptimEYES. Welcome, Jay. It's a pleasure having you on our program.
Thank you very much.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Jay, by having you please tell us what vision problem or problems were you experiencing that brought you here to OptimEYES and Dr. Mohanan.
Okay, well, actually, it was going on my 1 year for my exam, and I was experiencing some vision problems close in and my distance, as usual, getting old in age. So we're kind of like neighbors in the plaza anyway. I own a shop a few doors down and met them earlier, in that year. So I said, why not support our own people right in our own plaza? Seemed like some really nice people. The doctor is really, really good and makes you feel like family in here.
That's wonderful. So you were basically, from what you told me a moment ago, having a little combination of both near and farsightedness working?
That's correct.
And since you have gotten to know Dr. Mohanan, being near her and also her great reputation as a top optometrist in this region, you said, let me go over there and see what she can do for me. Is that what basically happened?
Yeah, that's correct.
So what happened once you got here then?
I was welcomed by the staff. Antonio and her met me at the door for my appointment time. And it was very simple. They walked me back, went through all the procedures that they needed to do. My background as far as my vision was concerned with all my other doctors that I've been seeing before this time.
Yes. And
the exam went really smooth.
Wonderful. And what was the recommendation at the end?
Recommendation for me was that I definitely needed an upgrade in my prescription.
Okay.
And what I liked most about it was that I really wasn't familiar with what kind of vision glasses that I needed. So she, walked me through the steps of what I should, 2 different styles of glasses that I should be using or could use, and let me try those out. And I went with the pair that she really said would help me the most, which was the multifocus that I have right now. Oh,
they look very nice also, by the way.
Thank you. And I give Antonio the credit on that because he helped me pick out my frames, sized them on me and things like that. So it worked out really good. That's
wonderful. And most importantly, besides the fact, like you said, they look really good and feel good, how do they work on you?
Great, great. It's definitely an improvement. One of the issues I had too, since I didn't know before, I always had to put my glasses on, take them off, put them on, take them off. Now I got one set of glasses that I can use and wear, consistently without having to put them on and take them off.
That makes it very easy for you to have to sit there remembering to do this. And then sometimes, as you know, and a lot of folks out there probably know what I'm talking about, you put them down and God forbid you forget them there.
Forget them. And, I was scratching up my lenses a lot because I was taking them off, sitting them down because my vision wasn't as bad far away.
Yes.
And so then I had to put them back on when I start to read again. And it just cured all those issues.
And I wanted to follow that up, Jay, by asking you before we let you go, for all the folks out there watching, what would you tell them about your experience, as you mentioned earlier, with everyone here at OptimEYES, the whole process?
The whole process from start to finish is great. They make you feel like family. You're not a number here. They remember your name. They'll walk you through step by step with whatever issues you're having with. And the care afterwards is important too. That's another reason I love them so much. It's like, if you have any issues with your glasses or your frame or anything like that, you just come back up inside and they'll take care of that issue for you.
That's wonderful. And on that note, Jay, we'd like to thank you for joining us, sharing some of your experience, and being a guest on our program.
Thank you, and you're welcome.
We're now back with Dr. Mohanan. Now, in Jay's case, Dr. Mohanan, it seems like he had both a near and farsighted problem. And the glasses that you customized for him, not only do they look good, but the results have been great, according to what he just told us.
Yep, and to take care of both his distance and his near in one pair made it much more convenient for him, and he wears them every day.
That's right, and as he said, and this is a problem that a lot of people have, by having a one pair to correct both problems, he doesn't have to keep forgetting about which one to put on.
Exactly.
It just keeps the one set on and he's good to go.
Yep, and he can multitask and go about his day.
That's right. Now, are there any follow-up visits that you require of your patients after you've customized an eye care solution for them? as far as coming back every so often just to see where things are?
Yes, we actually recommend yearly eye exams just to even check the health of the eye as well. But also, to double check the prescription, make sure everything's working correctly. Even if it's within the year, if they're having any trouble with their glasses or anything like that, they can always come back and we can see what's going on.
Yeah, and in fact, in Jay's case, again, you just talked to him a few minutes ago, he indicated that you see your patients at any time, basically, to come back and have something taken care of.
Of course, yeah. I mean, we want them to be happy. So if there's anything going on with their vision that we need to address, we can do that.
Well, that's certainly wonderful to hear, and I'm sure a big benefit for a lot of the folks who are busy and need the flexibility of evening or weekend hours.
Exactly.
Now, we're literally out of time, Dr. Mohanan, but you and your practice, OptimEYES here in Ashburn, Virginia, are certainly fast developing a reputation for excellence, not only in optometry, but also in patient care. I just wanted to ask you what you feel helps separate you and your practice apart from many of the others.
Well, we're really big on patient education. I think once you're really educated on what options you have, you can then appreciate the value of what your purchase is. A lot of times people come in here not really sure exactly what style works for them, but we offer great advice. We can actually make sure, many different styles, many different sizes, shapes, and they're more than welcome to try any of them on. And a lot of times they walk out with something that they would have never tried on before.
And it becomes their new style.
Exactly. And we also offer contact lenses for those that also, may want to have an alternative to glasses.
Yes, indeed, and you really seem to care for your patients. As Jay said, you treat them like family.
Yeah.
And that's something that you don't hear too often when we're visiting a doctor. So that's certainly also very good to know.
Thank you.
Well, on that note, we'd like to thank you, Dr. Mohanan, for educating us about the various advances in vision care and how we can benefit from them and being a guest on our program.
Perfect, thank you.